Thank you for joining us for an important discussion about the power of joining together and uniting as people living with obesity. My name is Christy Kuna, and I have the pleasure of serving as the Secretariat of the Global Obesity Patient Alliance, known as GOPA, which is a unified voice of obesity patient organizations from all around the world. And together, our goal is to impact meaningful change in the lives of people living with obesity. And in GOPA's short existence, we have already made great strides in working together to impact change in obesity. So what is the change that we want to see, and what action has already been taken? Well, I can think of no better way to articulate this important message than to hear directly from some of the member groups within GOPA who are the relentless patient advocates out there doing this important work each and every day. So it is my privilege to welcome them to this important discussion. First, we're representing Obesity Canada. We have Ian Patton, who serves as the Director of Advocacy and Public Engagement. Welcome, Ian.
Hi, great to be here. Thanks for having me.
Yeah. And then next, from the Obesity Action Coalition in the United States, we have OAC's immediate past chairwoman, Shelley Vicari. Welcome.
Hi, good morning. Thanks for having me.
Early morning for you. Thanks for joining us. We also have Vicky Mooney, who serves as the Executive Director of the European Coalition for People Living with Obesity, known as ECPO. Welcome, Vicky.
Thank you so much, Christy. A big hello from Lanzarote off the coast of Africa.
And we also have Ken Clare, who's the Director of Bariatric and Metabolic Surgery Services with Obesity UK. Welcome, Ken.
Thanks, Christy. Great to be here today. Thank you.
And also joining us from the United Kingdom is Sarah LeBrock. Welcome, Sarah.
Hi, thanks for having me.
And last, joining us from Germany is Melanie Balk, the chairwoman of the ACSDEV Obesity Surgery Patient Organization in Germany. Welcome, Melanie.
Thank you to be here, and greetings from Germany. Thank you.
Wonderful. You all look great. I'm so excited to dig right into this, and thank you so much for taking time to be part of this important discussion. And I do want to dig right in because there is so much important work being done by your organizations that has led to impactful change. And I really think it's important that you all share your experiences and how you work together with your members and partner organizations to make it all possible. So Sarah, I want to start with you because through your involvement with your previous obesity patient organization, you worked tirelessly in setting the standard for challenging governing bodies to provide more answers to the connection between COVID-19 and obesity, which I know has been something that all organizations within GOPA have taken note of. So can you talk a little bit about your efforts to ensure that the voice of the individual with obesity was heard and considered as we learned more about this epidemic?
Absolutely, yes. Thanks, Christy. Yeah, in the UK, it was very kind of quite early on. There started data coming through around the kind of increased risk with people living with obesity having more severe consequences to COVID and potentially, even dying. So this was heightened in the media, causing a bit of scaremongering. So it was kind of something we decided we wanted to do as an organisation, was to kind of say, well, what support are you offering for people living with obesity to kind of understand what they should be doing to protect themselves and in this pandemic? Because, we're all learning, it's something new for all of us. But actually, if we are at increased risk, kind of what should we be doing differently? So we kind of wrote to the government to kind of get some advice and get some more clear guidelines around it. And it took a bit of time, but eventually, they did start looking at the fact that people with a BMI over 40 were then classed as being more higher risk and so fitted into a different category. And there were different regulations around how that should be managed around workplace and interactions within society, etc. So it was just nice to get that bit of clarity, because I think, we know what the media is like, and we know how good they are at kind of spinning off a story and making it scare everyone and then actually not being very productive. So what we wanted was a bit more clarity. So it was just more around actually, people living with obesity, making sure that they adhered to social distancing, made sure that if they felt uncomfortable in the workplace and they didn't feel like they could social distance, that it was okay to say, I'm going to work from home, or I don't want to be in this place, making sure they wash their hands more frequently, and obviously, wore masks like we all have to. But it was just great to have that kind of clarity. And then as things have progressed moving down the line, people living with obesity with a BMI of 40 are actually now getting the COVID vaccine sooner than people, not in that group. So that's great as well, that kind of risk has been taken into consideration and is now being dealt with, and making sure these people are getting protected when they should be, which is fantastic. So it's a real positive step forward now, and I think people living with obesity are feeling a little bit more like they know why it's happening and why they should be protected, and just to make sure that they are kind of carrying out the right kind of protection for themselves, really.
Absolutely. And I think that, all that you spoke about are all the messages that we heard throughout the past year. And I think all organizations within GOPA have appreciated the work that you did to really push the agenda to make sure that the right messages and the people living with obesity could really understand how that impacted them, and lots of great things. And so we really appreciate you kind of keeping tabs on that for us, and leaning on you even over in the UK to lead that charge. So thanks so much for that, Sarah. We appreciate it.
Thank you.
Well, so as we think about the needs of people with obesity, especially during COVID, connection and support are two that are usually at the top of the list. So, Shelley, I want to pose this next question to you. You represent the OAC in the US, and this past year, the OAC made some great strides in taking connection to the next level through virtual engagement. We were all forced to do this, right? But can you tell us a bit more about your perspective on virtual engagement and how it's proved to be a powerful tool for not only support, but connection and action as well?
Sure. When the world went under lockdown back in February and March, we were really forced to look at ways to continue the work that we do, continue our education of people about obesity and bias, and continue to advocate and support our community and the general public. And I guess maybe the silver lining from the past year has been all the kind of new and innovative ways we've found to continue to do that work and reach people. And so we started a monthly broadcast on Facebook where we educate the general public about what's happening with the OAC, what's happening with GOPA, what's happening with obesity-related topics in general. And we wanted to continue our advocacy work. So how do we train advocates? We created a video series that people could log on and watch, quick 3-5 minute videos and learn the ways that they can help from home and without leaving their home. We did our virtual convention. We had planned to all meet in Las Vegas this year, and of course those plans were scrapped when travel and lockdowns happened. And but we still wanted to connect with our members and find a way to do that. And so we started a virtual conference, and it was actually record-breaking. We were able, without the constraints of having travel and time away from family and time away from work, we actually reached more people than ever. And so, those are the silver linings, I think, to all of this, is that we're finding new ways to reach more folks and connect, and more opportunities to engage with our folks and with the general public, and share what we want to share about obesity and how they can help.
Yeah, and I think that quick adaptation to the new world that we were all living in was very much felt. And I think one of the powerful parts of GOPA was that during that process, GOPA members and other patient groups were able to lean on OAC and their experiences, but also conversely sharing their own experiences going virtual, because I know each organization represented here has done so much virtual activity, more than we thought in this past year. So I find that so valuable. We were able to really share all that great learning information, the do's and the don'ts, right? Which is such an important part of GOPA. So absolutely, and I definitely think that virtual side of things is here for a little while, especially for something like this. But thank you for sharing that, and for helping to kind of pave the way a little bit for virtual engagement as we continue on in this unpredictable world. And I do want to keep on that important topic of support and how we've all had to adapt in the era of COVID. So I want to turn that next question to you, Ken. Your organization, Obesity UK, did some really remarkable work to ensure that support continued throughout this time, and that was through hosting of support groups and other opportunities to connect. So can you share a little bit about this experience and why it was so crucial to you and your organization to ensure that this continued?
Thanks, Christy. And this echoes with everything already said by Sarah and by Shelley. And I think that we entered into the pandemic, we knew that people living with obesity often have higher levels of mental distress, diagnosed problems with like depression and anxiety and stress and loneliness. And I think that these things, when we realised that our face-to-face meetings were taken away. We realised there was a massive gap, and we aimed quite quickly to plug that gap. And Zoom went sort of within a week from being something that nobody had ever heard of to being an almost universal application, and used in family parties and different things like that. But we opted for Zoom. There was technology challenges. Not everyone's got broadband, Wi-Fi, digital access, and some people dial in on calls, and that's fine. It works for them. And we've been really able to get people to access support, even where they had no technological experience before, and that's been crucial. But loneliness keeps coming through as an underlying theme, and you know, the stigma of living with obesity in a society maybe where you feel shunned. You can be lonely in a multi-occupancy household, and I don't think people quite understand that phenomenon. And it's interesting, I think we're going to see more of that as we go on. And we've run a mixture of peer support groups. We've run some speakers, because people living with obesity are, I don't want to say a broad church, but we're a wide range of people. Some people want to know the science, the genetics. Some people just want to know 10-minute chunks. And we've tried to meet that in a variety of ways. And 10-minute interviews are something that I think there's a sort of pressure to put on. I think that we saw some of our medical colleagues were trying to do 8-hour conferences without a break. And normal people don't want to do that. You know, I absolutely need to get up every hour and make a cup of tea. We needed to support our volunteers, and we all thought it was all going to last about a month, I think. And here we are now, nearly a year on, and I think that fatigue has been cumulative, and it's taken it out of the people doing the work. If I look back, I'd say to be kind to yourself going into this, and pace yourself, because I think that that's been the big lesson for us. And we've developed 3 volunteers doing facilitating groups, and they're Beth, Jimmy and Bev, and I wouldn't have been able to do any of that without them. And I think it's brought us closer to the people, and we're going to continue with a mixture of Zoom and face-to-face, whatever happens in the future. Thanks.
No, thank you, Ken, and so much for us to learn from as we think about support in so many capacities. And you all have really led that charge to really adapting to all different needs when it comes to support. Because as you mentioned, not everyone has accessibility to some of the technology. And so you have made that work in this era, which is something I think all organizations in GOPA have really leaned on to think about and to consider. So thank you for sharing that, and we're excited to continue watching your lead in that respect. But Ian, I want to shift gears a little bit and talk about the efforts of Obesity Canada in the launch of 2 integral initiatives and the release last year of the Canadian Clinical Practice Guidelines, along with your new patient community, OC Connect. So you launched both of these during the pandemic. You probably didn't expect to do that, right? But safe to say they were in the works for quite some time. So with the pandemic, these launches came at really perfect timing because the need for obesity care is growing, along with strong connection points. And you know, I know you all had some important additions to the guidelines that addressed weight bias and stigma, which is a unity point for all of groups that represent in GOPA that we really want to see weight bias and stigma go away. So can you share a little bit about how these new guidelines came to be, what impact you want them to have on the patient community, and how your new community has been received since its launch?
Yeah, thanks. It's been an interesting year for sure for us and the work we've been doing. We were a little worried about launching the guidelines in the middle of the pandemic in terms of like when it got published. They were done a little bit before that, and we were hoping they'd be published earlier, but then the pandemic hit, so that kind of threw things for a loop. But it actually worked out fairly well, because when it was published, there was something that generated a lot of attention, and people, you know, started reading them and paying attention, and it started a lot of good conversations about obesity, which was really good. They were a very large project, so it started about 3 years prior. It was a massive undertaking. There's over 60 authors and over 500,000 journal articles reviewed to come up with these guidelines. And the guidelines are typically used by healthcare practitioners, generally, general practitioners that are using them to guide their practice and keep up to date with best practices and the evidence. And that's what we set out to do, but we wanted to be a little bit different with ours. So we wanted to make sure that, as you mentioned, weight bias and discrimination was a kind of key point in that. And so we asked all the authors to use a little bit of a weight bias lens as they were going through and doing their chapters and recommendations. And then we also ensured that the patient voice was heard throughout the process. So we made sure that people living with obesity were part of the entire process. They were reviewing recommendations and providing input and feedback on those recommendations. And I think the exciting part about these guidelines that we developed is that the hope is that it'll create a bit of a grassroots movement. So the patients uptaking the guidelines or the recommendations and using that to drive conversations with their doctors rather than the top down that we typically see with clinical practice guidelines. So really excited about the potential there. And then kind of in conjunction with that was the launch of our OC Connect community, which we felt was really needed to have kind of a private, moderated community that people could come and have a place for peer support and education and empowerment. And it's been really exciting to see people engaging in there. And for us, it's a bit of a way of using it as a knowledge translation tool. So spreading the knowledge and the stuff that's coming out of the guidelines to the patient community and kind of empowering them to ask questions and get involved more. And yeah, it's been really, really well received. We've got over 1,000 people who've already joined, and it's growing every day. So really excited about it.
Well, congratulations on that, because I know that it was a very interesting time to do all that. But I think as you mentioned, it was really came at that right time and the need and really was able to divert us into the right direction of where we need to be thinking and as the patient community. So we're excited to see how that continues, and congrats on all of the success so far. But in keeping along with the discussion of weight bias that you just touched on, Vicki, I want to next come to you. Since the launch of ECPO in 2019, it was such an exciting time. I know we were all there as you guys were cutting that ribbon at your booth at one of the conferences back then. And you all came out right away, though, with strong campaigns to combat weight bias. So can you share a little bit about these campaigns, how they've made an impact so far, and what you hope we can do together in our own countries to impact change in bias?
Yeah, thanks, Christy. I think this ties into a lot of what all of our organizations has done for many years. But for ECPO, I think we've been a patient council for many years and quickly realized the need to kind of collaborate with all countries across Europe to pull that really strong, united patient voice together, as we've so many amazing national leaders and patient communities. So we pulled them all together and created this community and came out following really our Canadian colleagues and you guys at OAC with our own People First campaign for Europe, which we didn't realize would have such a strong impact. And it was a real eye-opener because it was a way to kind of engage with healthcare professionals from the patient community and open a conversation that hadn't been had before, and we've seen quite a lot of discussions and change in abstracts and symposiums and in conferences quite quickly once we launched the campaign. Now, I suppose when COVID hit, one of the things that we all seen was, the awful stigmatizing memes that were doing the rounds. And I think obviously, being at home in the home environment just fueled that societal belief that obesity is purely, we're lazy and we need to put the donut down. And that really kind of struck us that, right, we need to move quickly on this. So we created a Living with Obesity Day campaign to kind of branch off from the People First language. So instead of just, having a call to action for People First language, we wanted to educate people on what it is like for people who live with obesity. And with our 27 countries that we collaborate with in 15 different languages, in one day, we managed to have about 8 million impressions across social media. By working with all of our colleagues and all of the national representatives. We gave grants to assist their, stigma and weight bias work in their own country, so they could also have it in their own languages. We'd translated materials. It was quite fantastic to see, and the excitement around it, and patients feeling empowered. and a great opportunity as well to educate, not only healthcare professionals, but, families and, teachers and literally everybody it reached. On the back of that, we noticed that, right, we have an opportunity here to talk more with our patient communities. And the opportunity to educate was like really kind of like hanging there like a low hanging fruit. And I think you guys in OAC kicked off quite quickly with your OAC broadcast. And we followed literally a few weeks later with the Patient Lounge, which was another way for us to break down that stigma, to talk about things like women's health and obesity, to talk about men's mental health and obesity, and educate people on what is important, what should be discussed at the dinner table, and that we shouldn't feel ashamed, that we shouldn't have to hide. And since then, we've managed to pull together 3,101 responses on a Europeans survey across 10 countries in Europe. And a lot of that will tie into some of what Ken has actually shared, and the loneliness we're seeing, stigma and weight bias is still predominant. And we're going to launch obviously all these details and top line results on World Obesity Day. But, I think combined together, we are all doing a tremendous job. Each and every single person on this call has played a humongous role in that. And I just applaud all my colleagues here, and we're super grateful for the opportunity.
Oh no, thank you, Vicki. And you actually were like thinking or saying what I was thinking, is that it is remarkable that all the groups on this, not this call, but other groups as well that are represented within ECPO, we're all working together. And though we may not have exactly the same initiatives, we're all supporting one another. And I think the work that you just mentioned is just such a reflection of that. So thank you so much for noting that. You literally read my mind there at the end. But as we do begin to close, which I know we could spend all day talking about these really important topics, I do want to finish off by talking about impacting change through policy, which is often one area that many think about but don't really know where to start, or just how powerful their personal story can be. So I want to direct this last question to Melanie, because your organization in Germany had a pretty big win last year with obesity being declared a disease by German Parliament. I know this was a long time in the making, so can you tell us a little bit about how this and how this and your members work together to make all of that greatness happen?
I try. In Germany, as in many other countries, stigmatization is still high. I have volunteered as a patient representative for more than 13 years, and I used to be hiding because of my weight. I have 180 kilos now, and it is hard to stand up and give voice. And it fills my heart with tears of joy when I see what I achieved in the last 3 years. Years of work together that is so phenomenal for me that I can cry the whole time for having this. What began as 2080 at the German Open delegation and the Obesity Week in Nashville. Now it is the German Obesity Alliance. And that is, we are patient representative, and we work together with politicians, healthcare insurance, industry, professional societies, and we work together. That is a thing that we never done before. And that is a thing normally I feel I'm so little, and now we are the same. We have the same level, and that is I can't believe it. And but the different all the years before, I think that is a little bit empathy. The people they are work together, they feel, they see me and can feel what is obesity for me and what they work together for other people. And they see obesity with with his own eyes, and they see that the people struggle every day, and slow and little pieces, and but they are not lazy. We are doing many things. That is great. And we are not only the number on the scale, we are now people who live with obesity. We are not the disease. And that is a thing, I think that is something that we change together all. And that is the thing that I say thank you for all. And I say that is maybe the patient power or the power of empathy. When you have or when you find the right people that they can work together of empathy base, that is a very strong level. And that is a very good way to work together. Maybe it not works in every country. Yes, maybe. But you can try it. And maybe it works. And that is the thing that I learned from GoPam. And I think maybe someone look at this call and feel the same. And maybe he say, okay, I must write an email to Kirsty. Do this. Feel free, send us emails, come into GoPam and try to make the world to a better place for people living with obesity. Thank you.
Oh, Melanie,
Thank you all.
No, thank you. I think you could not have ended on the better note for this important discussion. And, I honed in on, something that we all believe that we're really trying to really convey is that to working together, making lots of noise together. I think the work that you all did in Germany took a lot of effort, a lot of noise and voices. And I think all the efforts too that you talked about around bias and empathy and creating that, all these groups are doing that in different parts of the world. And so though our cultures are different, our healthcare systems are different, we do unite as patient groups to fight these issues that commonly affect any person who is affected by obesity. So thank you for ending us off on such a great note. But I do want to thank all of you for sharing your perspectives and experiences. I think you've all done such an amazing job of showcasing the power and importance of uniting to change the world for people living with obesity. So we hope that this discussion has inspired you to get involved, as Melanie just kind of did our rally cry at the end to connect, and that you can connect with patient organizations in your region, or even think about starting one as well, which is really, really a monumental but important task. So if you're unsure that an organization does exist in your region, you can pledge to get connected and provide us your general information at www.gopa.org/connect, and we will get you connected to the closest in your region or direct you to where you can get more information on establishing one. So again, we hope this discussion has given you just a glimpse in the power behind working together. Safe to say every person on this call works tirelessly. Your volunteers and members work tirelessly, and it really takes a village to impact change in obesity. So this is an example of that. So from these organizations, we learned that it's patient engagement and action on weight bias and stigma, disease awareness and policy influence, all these things that we can all be doing together to make a big difference. And it does take us doing this together. So we hope you're going to join in this effort. Thank you for being part of this discussion. I just want to again thank each of you for being part of this discussion. I know we have these great discussions all the time, so thank you so much for taking the time. Quick final words as we round out the discussion. Any reflections from the whole group?
I'll say something. I just wanted to say, just hearing everyone's kind of reflections again and just sharing what everyone's been doing across the country just reminds me again, even though I knew these things were going on, just how much of an impact we are literally having kind of across the globe. And it's just so important that we continue to do that and continue to have that voice. So thank you for sharing, everyone. I've really enjoyed listening to them again. And please, people watching, get involved. More voices, the more powerful we are. So that's what we need. So get involved.
Absolutely.
Thank you.
Hear, hear.
Yes. Well, thank you. We'll end on that great high note. Thank you again. Please connect with GoPa, and best of luck to all of you, and congrats on your great successes this year. And we will see you online.